Hi, my name is Valerie Varan. I'm a licensed professional counselor, a holistic life coach, and author of the book Living in a Quantum Reality, Using Quantum Physics and Psychology to Embrace Your Higher Consciousness. With me today is Paty Shives, and I'm going to read a bit of her bio because Paty and I met recently at an event and we got to talking about her journey. And I just thought it was really, really important that we go ahead and talk on YouTube and present it with all of you guys. So here's a little bit about Paty. She's a survivor of a brain injury that occurred almost 20 years ago. The brain injury came in the form of an intracerebral aneurysm centered in her thalamus that resulted in a hemorrhagic stroke. This type of stroke is different from a common stroke that usually includes a blockage in the blood vessels in and leading to the brain. Paty had a blood vessel burst within the main control center of her brain. While she had no cognitive or speech damage, she was completely paralyzed on her left side. Initially, the doctors told her that she would likely not walk again, or if she did, it would take a long time and would require some type of assistive device. Paty took charge of her recovery from the onset, determined to utilize all means of recovery available to her. She has been on a 19-year-plus journey to redefine her physical mobility and to recover to the best of her ability. Not only did she walk again, she has managed to continue her recovery almost 20 years later. So thank you, Paty. Thanks so much for being able to have this conversation today.
Thank you, Valerie. I appreciate being here. Thank you very much.
Absolutely. So maybe why don't we start with here you've had this horrific stroke. I think it's important for viewers to hear like what all, more details about what you were told to expect and how you ended up taking charge of your recovery.
Absolutely. I think it's good to start by saying you don't hear people say this very often, but I was tremendously fortunate. I think I'm what you would call very lucky in misfortune because I had the aneurysm right in the center of my brain. It's called a thalamic stroke, and it happens in your thalamus where it controls everything, your speech, your movement, your temperature. The ability to think and see and talk and hear. And so usually that kind of stroke has about an 80% mortality rate. And those who survive are left with really very little function and a lot of cognitive damage. So I think I was really fortunate from the onset to have the ability to think and speak and reason. And while the left side of my body was completely paralyzed, I was fortunate enough to be able to strategize my way out of, thinking the negative thoughts of never recovering again, but really to put together a comprehensive program that has changed and grown over the years that has not only gotten me back on my feet, but helped me also to weather, the ups and downs of recovery. As throughout the years, it's certainly not a straight line. So I think I'm incredibly fortunate, not to say it's been easy, but I'm happy to share. Everybody's different, but I'm happy to share the things that have worked for me during my recovery that hopefully will help somebody else who's struggling with this diagnosis and the uncertainty of their future.
Well, and especially as you just pointed out, you heard a prognosis of 80% mortality. Maybe we should start with what you just said. How on earth, when you hear that news, how did you manage to be positive, right? There's a lot of people who will be, oh, just be positive, just be positive. That's very difficult for so many people to do, especially in the face of such a prognosis.
Yeah, it's a challenge. I think when I think back to it, it was so much more than just the shock of hearing that diagnosis. As the days unfolded and I started to learn more and more about what really happened to me, the disbelief of what I was hearing turned to, unmitigated fear because
Yes.
not only did I read in the early days that there was an 80% mortality rate, But I also read that within the next 30 to 90 days, I had a very high chance of having an additional bleed that would indeed kill me. So there was a lot of, living on the edge for the first 90 days. And the more I read about, the more I asked questions about the condition, I was terrified, not just that I wouldn't live, but really terrified to find out just how grave this condition is and how very few people truly recover from it. And so there was a lot going on at the time. And when you ask about, what is it that, sort of got me to thinking about taking charge of my recovery, I think the tipping point came when I was in the rehab hospital. When you have this type of injury, they evaluate you in critical care or ICU for a while. If they feel like you're not young enough, you're strong enough, and that you have hope, they will send you to a physical rehab to try to learn the basics, right? And I mean the basics of transferring in a wheelchair, being able to bathe yourself, feed yourself, clothe yourself, all those things that just, a few weeks earlier were second nature to you. So I was fortunate enough that I was all of those things, young enough, and capable and strong enough to be able to be sent to rehab. And so the first few weeks of rehab, as you can imagine, were terrifying, as I learned more and more about the condition. And I just remember one day I was wheeled back into my room and I had just a few quiet moments by myself. And I realized, I have a choice here. I could sit in this wheelchair the rest of my life and, nobody would bat an eye on it, about it, or I could fight. And no, now I don't use the word fight, but back then I did. I used the word, I could fight and I can do every single thing I can do to get back on my feet. And it was also really important for me to not be a burden to those around me. I was a tender age of 42 years old. I thought about, what having a severely disabled wife might mean for my husband, who didn't ask for this, and what it might mean to my family, who might have to change their life completely to care for somebody who, is in a wheelchair full time. So I really made the choice at that moment to fight. And what that meant is to find out every single thing I could about recovery and to engage in it. One of the other things that came up for me is I really do believe that everything in your life does prepare you for what you're going to face. And I was a serious athlete when I was a kid, and I trained for probably 18 years in a couple of different sports. And I had some really tough coaches, and I was always thinking, why am I doing this? I realized at that point, that's why I did it. It prepared me for the mental game that I was going to need in order to do this recovery, because not only was it very physical, it was also very mental. And had I not had that athletic training, I don't know if I would have been as prepared to, engage in that recovery journey. So I think that was the tipping point for me.
So that really makes a lot of sense, right? You had all of this athletic training, the rigorous physical as well as mental training that you took on as an athlete. And here you were, it sounds like maybe the first few weeks were really, really rough. But after that, you were thinking of your family. You were thinking of, wow, do I really want to put them through what that means to care for someone in this position? And so it just sounded like that was so motivating for you that you applied all of that athletic training right to this situation for yourself, even mentally.
Yes,
Yeah,
absolutely.
amazing. And so, what were some of the first things that you dove into uh, that really started to give you hope physically, or at least started to provide you the direction of what all of the treatments that you were going to include?
Well, the first thing I did was observe. I've always been a keen observer. And I looked around and I watched what was happening in physical therapy. And the approaches were vast, as you can imagine. There are people who have severe injury to their brain. They did not retain the ability to think or reason or control their emotions. And so, the approach of physical therapy sometimes was a little overwhelming. and people chose not to engage. And I really did believe that if I was going to get better, I was going to have to do everything they told me to do and then some. So I really applied what I call the power of 100, which is, if somebody told me to do, 3 sets of 10, I did it times 100. I did 1,000 reps. I did as many reps as I physically could. And I made sure that that was my 100% focus. I also made sure that I understood and observed what physical therapy really meant. And what I've learned over the years is physical therapy comes in all shapes and sizes, and it matters who's doing the physical therapy for you. So, there are people doing physical therapy that, are calling it in, right? It's just really a job for them. And then there are people doing physical therapy that make it their lifetime vocation. And they're what I call having the right hands for the job. They're the people who, when they put their hands on me, I could feel, really empathetically that they were fully engaged in helping me. So I learned early on, first of all, to understand, what's the assignment? What are they assigning me? How will it help me? And how can I take that and do what I need to do to enhance it by 10 to get me better? And then I also thought about what I needed to do in terms of finding the right people to help me recover. And I kind of stored that in my memory bank. I really asked a lot of questions. And honestly, Valerie, the answers scared me. They really scared me. Like when I asked the question, when do you think I'll walk again? And what I heard, first I saw it in their eyes, and what I heard was, gee, you're probably never going to walk again. And if you do, you're going to need a pretty significant assistive device. So, what you might want to consider is going home and, putting, modifying your home and putting a wheelchair ramp in and do the best you can. Maybe down the road, hire a caregiver to help you. And, those were answers I didn't like to hear, but they educated me and they gave me another, thing to hang on my motivation, sort of board, if you will, to think about as things got tough, right? There's really, one of the things I realized too is there's never the same recovery for everybody, right? Everybody has it, no matter how hard you try, sometimes things aren't going to improve. But what I did know is if you didn't put 150% in, nothing was going to change.
Well, and I think what you're highlighting for the viewers is you can't just take what they're telling you and consider that that is it, not only in the prognosis, but even in what they're telling you to do for your physical therapy. Like you applied the Olympian approach right from the beginning. No matter what they said, you were going to be proving them otherwise. And no matter what they said, you were like, okay, well, if they're telling me to do 10 reps, I have to do that times 100. And so no matter what, it goes to show you this determined, effort that you really, really made. Now, when you and I were speaking, I remember bringing up the word neuroplasticity because anybody who's ever been my client has heard the word neuroplasticity at least probably once per session, because to me, it's one of the single biggest important things that most people don't know about. And neuroplasticity, for our viewers, is, even when I was in grad school, they were trying to tell us that, you only have so many nerves and then they die, but there's no such thing as neurogenesis. And I remember thinking to myself, hold on, I've heard about some research and it's not even making grad school. And I knew that that wasn't true. And so neuroplasticity is the word that we use for plasticity of the nerves, the flexibility, the movement of the nerves. And a related topic that I'll just touch on is epigenetics. So there's a field of epigenetics that means it's not just our genes that plays a role in our physiology, but epi meaning there's the way we consciously engage within our environment, like that has effects and it can even change the genes. So for example, They've been able to tell that if someone has had a trauma, which certainly a stroke would be a trauma, but if someone's had a trauma, your genes get affected. And if you don't have any kind of recovery, then you're going to pass along those traumatic, like PTSD genes, along to your offspring. However, for the people who end up, recovering, the genes actually change. So our genes are pliable, they're changeable. Our nerves are pliable and changeable. So I'd love for you to address the role of neuroplasticity in your recovery.
Thank you for that. I think the first time I heard the word neuroplasticity was probably a year after this happened. And
A whole year after it happened, as
the
opposed to
whole
the very
year,
first physical therapy or the very first prognosis conversation, a whole year after.
whole year after. When this happened to me, I consistently heard from every level of the medical community that services this type of a condition that, really you have about a year to make any kind of improvement you're going to make in your brain. And, it was backed by, I think, valid research at the time, right? Which is why I'm so grateful to live in a time of such amazing, modern medicine innovation, because at the time there was a belief that, the brain would probably recover. And it was really being looked at from a place of recovery, stabilization rather than regeneration. And I think that was valid. However, about a year into, so by the way, let me back up a minute. When I
Yeah.
heard that diagnosis, I thought I better get to work. And the first year was exhausting. I really was doing every single thing I could to recover as much as possible under the fear that it would not happen again, or it would not improve after that. Well,
Yeah, that you
fortunately,
would have that limited window.
yes, that what I had at one year was what I had. And fortunately, I lived in the Bay Area in California at the time, where we really are the epicenter of technical innovation, and not just technical in terms of engineering, but in biotech and biomedical and pharma. And luckily, I was hooked into that community from the work that I did. And I was able to hear about new research that was coming up in this great thing called neuroplasticity, which said maybe the brain keeps recovering after a year, after all. So I started to seek out physical therapists who had expertise and an interest in neuroplasticity, because first they had to believe it, right?
Yeah.
Believe every to forget everything they'd been told by the medical community. And then they had to do a lot of work to get trained in how to really help people to engage in neuroplasticity. And so I was very fortunate. I found a physical therapist who had a PhD in neuroplasticity, a very forward-thinking physical therapist, and I trained with her. And she taught me some really interesting things that I've held on to for the last 20 years, and that is neuroplasticity is very complex, and it comes from engaging traditional physical therapies and traditional medicine. And then it includes some of the things that have been poo-pooed a little bit by modern medicine. It's including visualization. It includes, uh, you know, some of the consideration of epigenetics, but I think at the time it wasn't called that, right? And it was
Yeah.
also including some really amazing things that took some of modern medicine, like stem cell research and chiropractic, and really all of the things that have been on the fringe of Western medicine. So, neuroplasticity included many areas that were merging both Western medicine as well as holistic medicine. And she was really amazing in helping me with incorporating those kind of things into our standard physical therapy sessions.
Oh, I'm so glad. And just for our viewers, we can think of when we're engaging with a neuroplasticity, a mechanism in our body, we can consider that anything we do repeatedly, we are actually rehardwiring for. So, right, no wonder we have behavioral habits and even thought habits, because as we're doing things repeatedly, then we have increasing connections amongst our nerves. Like the branches are growing, the root system is growing, and the connections are growing all over the body. And in a way, it's kind of like, okay, well, that's a pain in the rear because now we have these habits. But I feel like it's such good news because it tells us that when we make a conscious decision to do something new, like you said, we can engage with neuroplasticity and go ahead and create something new, even structurally, physically within our nervous system and our entire body. So, yeah. So here you were hooked in to the Bay Area with all of this. And about what year was this?
The aneurysm happened in 2006.
Wow. So, I mean, by the time, I mean, we're really talking here, the latter half of the year 2000s, the decade of the 2000s. And I'm thinking how long that research had been out and you were just now hearing about it, but only because of the effort you made. So continue on with this amazing story.
Well, and it's interesting how neuroplasticity plays a role in where I am today because, this is a long 20 years and a lot has happened during that time frame. And I'm so grateful for the early years because they gave me such hope. So after a year, I was able to get back on my feet shakily. I walked very slowly and, it was a dangerous time. I really could not feel my left side at all. I had no sensation on the bottom of my foot. I had a complete lack of proprioception. And for those who aren't aware of that, it's actually the ability to know where your limbs are. And so I really had nothing on the left side. I was blind on the left side, if you will, from a feeling standpoint. So there was a lot of inherent danger in that
Yes.
because when you're trying to walk and you can't feel that left side, a lot of things can happen, right? You can fall a lot, you can injure yourself. And what happened to me is I did a couple of things. First of all, I put together a program that I would call a sort of world-class training program that incorporated physical therapy. It included weight training, cardio, running, swimming, every yoga, Pilates, every single thing that would touch the tip of my toe to the, to the top of my head. And to do that, I was probably engaging about 6 hours a day, 6 days a week in doing these really hard physical things on the body. And after about 4 years of, 6 days a week, really hard training that you would see, people at the elite level do, at the age of, 42, 45, 50, that takes a real toll on your body. And what I realized is that all of the work I had been doing to get me back on my feet and get me strong again had actually started to create a lot of injury in my body. So I had, I blew out my shoulder, I had stress factors, I had, I'd rolled my ankle a couple of times and had broken it severely and torn tendons and ligaments. And there was just a lot of injury to contend with. And as a result, over the last, I would say probably 16 years, I've had 17 surgeries to either correct broken bones or some kind of a blowout that was a result of, the recovery program that I was in.
What would
I
you like to say to people who would say, man, that sounds like it's not even worth making all the effort you did?
was absolutely 100% worth it, without a doubt. I was able to get back on my feet and engage in my profession again. I'm a global HR executive. And I was able to actually, get on a plane and fly around the world 50% of the time for probably a good 5 to 8 years after I had recovered enough to walk. And, what I can say about that time frame is for the first time in a long time, the fear that I had dissipated, the fear of not being able to walk or function normally, but what that would do to my life, right? That it would make my life very small and I wouldn't go out and be able to experience true independence. That's so important to all of us. And so I would say anybody who's thinking that it might not be worth it, it is absolutely worth it to know that you can confidently go out on your own or travel on your own and make decisions for yourself that are beyond just learning how to dress yourself or transfer in a wheelchair. And I don't think people realize unless it happens to you how incredibly powerless you feel when you're sitting in that wheelchair. So I would say if independence is important to you, if having the ability to control your life is important to you, and not be in fear, then is absolutely worth it. Because I think when I look back on it, I would trade in, a surgery or two every year for the ability to walk, right? And to function normally in my life. And, while I admit it has not been easy, right? There have been times, I'm actually going through a time right now where I've had so many surgeries that I've become very weakened, and I've actually regressed in my recovery from where I was before. And there was something really frightening that came along with that because I started feeling all of the old fear come back of, gee, what if I don't recover again? What if I'm going to be in pain the rest of my life? Had I not gone through what I went through, 19 years ago to get back on my feet, I wouldn't be holding on so closely to the ability to recover again. And it's been almost as hard as it was when I was initially paralyzed to recover this time. But I'm happy to say all of the things I learned, all the things I went through have taught me a lot about the recovery game. Having an aneurysm like this and being paralyzed is a gift that keeps on giving, right? You don't ever really flip a switch and you're 100% again, right? I think, maybe at my best I was probably, 60%, but it was enough. It was enough to have a life and have independence and control my own life. And I think that that is really a powerful thing for anybody who's looking at the prospect of not ever recovering again, right? And that the neuroplasticity, by the way, the things I learned about that were the most important thing in helping me later on in this recovery to get through the surgeries, to remember that I can recover again and that I have control of that from a neuroplasticity standpoint. That's a very powerful thing
Yeah, and can you elaborate on that?
about the
Uh, uh, the
recovery.
way the neuroplasticity was so important, the way that you really engaged it, like even at the mental level, right? How was
Yeah.
that speaking to you? How did that drive you?
Well, I think because I really came to a point about 4 years ago after a series of, 4 or 5 surgeries all in a row. I wasn't young anymore. All of a sudden, I wasn't recovering like I used to before the prior, sort of 10 plus surgeries. And I really got scared because I thought, wow, I've really gone backwards. What if I can never get back again? And, again, I can't emphasize enough what a powerful emotion fear is, right? It makes us do all kinds of things, mainly give up or look for excuses to not do everything we can because it's hopeless, right? So I want to express how important the thought and the action of neuroplasticity can be in addressing those fears. When I came to this place where I was very weakened, I realized this is going to be a really long crawl back. How do I do it? Right? I need to go back into my arsenal and look at all the tools I used to get to where I was. And honestly, some of them didn't work anymore, right? I was aging to the point where some of the really brute physical things I did weren't working anymore. What always worked? Neuroplasticity, right? But I had to take it to a new level. I had to get some help with people who had experience with neuroplasticity, and I had them remind me about what it was about neuroplasticity to help me get there in the first place, right? And to also educate me on what had happened in the last 5 or 10 years in the progression of neuroplasticity that might give me some new tools to work with. So I went back to the well. I was able to find a really amazing physical therapist who, ironically, I'd been wanting to work with for many, many years. And she helped me to really hone in on visualization. That's so important when you're compromised, right? Visualization, visualizing the neurons in your body that come from your brain and extend down into your arms and your legs and every part of your body. The visualization on how to walk normally again, right? Really important stuff. Visualization on how to trick my brain in when I'm on the 20th lap of going past my limits in the swimming pool. How do I get to my how do I reach deep down inside and find that little bit of energy left in the tank? Well, it's about visualizing it, and that's a super important part of the act of neuroplasticity, right? Also, energy healing, I think, was really important. As I mentioned, I'm an HR executive, but part of what I do also is executive coaching. And I decided during this time frame when I was in my recovery to dig a little deeper into executive coaching. And I found an organization that does a lot of work in energy healing and really comes to executive coaching, which is ironic in the business world, really comes to it from a place of energy and what we bring to the party when it comes to energy and how powerful that energy, whether it's positive energy or negative energy, impacts our ability to function on a daily basis. So really allowing myself to get out of my strict business brain and really incorporate some of the sort of less business side of thinking and energy was really important to me in order to sort of get back on track and start to recover now in a different way than it was back in the early days, which was a lot more physical work. Now it's a lot more mental work, really, as I get older and can't do the things physically like I used to.
Right. And what I love about this story for viewers is they're hearing all of the mental fear. They're hearing how you're working not only the mental, but the physical. But the mental has the thoughts, the energies, the emotions, but it also incorporates the visualization and what have you. So the role of consciousness at large. And let's pause there for a moment because I think it's so important. When they're doing studies with the brain, it's fascinating for me as a psychotherapist by training to really hear how the brain doesn't much know the difference between what we call real and tangible physical versus what we're imagining, right? Versus what we're watching other people do. So for viewers, imagine that your nerves, your cells, your atoms are literally conscious. Imagine that. We have theorists that are finally getting there. And imagine that they're truly conscious and that they're always learning. Like the whole body is just a learning machine. And if someone's in physical therapy, they're watching people do things and their body is learning by watching, just in the same way as when we're toddlers. Part of our learning to walk is watching other people walk. And the brain is engaged as we're watching people walk. And that is happening in, like you said, physical therapy. At the same token, we know the physical workouts, and obviously we get how that, from a strength training, athletic training, we get how that literally builds muscle memory, if you will, nerve memory. And at the same time, imagery. The traditional group isn't quite understanding yet how imagery really can work. But if we start realizing that everything is conscious at its own level, then we can realize that as thought is projecting direction, right? We're attending to something, we have an intention to something. We're really putting out a set of instructions to our biology, to each of our cells. And so when we're learning energy healing, what we're really doing is attending to a place that needs healing. We're intending a state of healing. And it's interesting how even for beginners, even learning energy healing on day one, we can, for example, start really feeling energy that's emanating from our hands. And we can feel how it's activated by our attention and our intention. And it doesn't just flow through our hands. I think hands are emphasized because there's such a tangible feeling to it. Like right now, just talking about it, I can feel my palms engaged. And in research on energy healers, they've really been able to measure strong biomagnetic fields flowing from the hands during energy healing. So backing up from a big picture standpoint in your story, no wonder that all of these levels were engaged in your healing. And what I find, like, I'm so grateful for you, that you found a really strong trainer that believed in using imagery. I mean, most people kind of poo-poo that. And I would love for you to share more about what did she say about that? Why did she feel it was so important?
Well, fortunately, she has been in the field of physical therapy for over 50 years, and she was instrumental in founding sort of new levels of physical therapy. In the profession. So she, I think, is an innovator, and she has been involved at the medical research level for many, many years, and has been able to see the connection between the physicality and the imagery. And she's been able to take that imagery to her physical therapy practice and use some of the physical tools that we have and merge them with the sort of mental part of it. And she's seen tremendous results. And I can't emphasize enough how important that was for me at the time in my life that I'm still working through of really regressing in my recovery and having to come from a place where I was feeling like I was almost starting all over again. And really, I really do believe this, that things come to you in your life when you need them. The universe sends them to you. And I think anybody who doesn't believe that has probably never had this kind of an injury, right? And I think that what I recognize is there's a bit of an arrogance that comes with full physicality. And I say that from experience, right? Because I have experienced full physicality. And I know that I wasn't open before that to hearing about things like neuroplasticity and intention and energy healing because I didn't need to, right? So
That gives
anybody
me chills.
so anybody who's feeling that right now will probably be a little bit more open to understanding that, right? And what I also didn't understand, early on, you were talking about energy in your hands. Early on, I think I mentioned, the physical therapists in the beginning were who I thought had good hands, right? And when you said that, I actually just realized the reason I felt that is
Yeah.
that the moment they put their hands on me, I could feel that energy of intention. And I think there are a lot of people who, again, won't understand that and aren't ready yet to onboard it. But it's an important part of recovery, right? Because every moment in recovery is precious, right? You never want to lose a moment of intentionally working on growing those neurons, in doing everything you can holistically, right, to improve your physical condition, right? And that includes
Yes.
engaging in some of the things that you don't understand, right? And I think that's a good way to look at neuroplasticity. People don't understand it, and that's okay, right? But you will experience it when you become open to the healing. And I was lucky enough to have that experience with some people who did believe in me, who saw that I had the capability to think beyond just, the daily reps and the things that the medical community had shown me, right? So there's a little bit of, being willing to engage in it and being open to experiencing it when it may be so foreign to you, right?
So what you're also describing is how going through this experience, you really felt was the universe's way of opening you to a whole world that you never knew about. I do want to move to the specific treatments soon, but I want to jump on something that you said, and you were realizing, right, as I was describing, let's say the biofield, biomagnetic fields coming from healers' hands and things like that that have been measured in research. And you started realizing, wait a minute, no wonder I felt their hands. No wonder I could feel something different. So I think what's important for viewers to know also is what's called energy resonance and entrainment. So in energy healing, for example, what we know is we will put ourselves in these states of energy that are considered very organized and very coherent. Coherent energy is like a laser of energy, very organized, and uh, you can really compare it with a flashlight, where the light's more diffuse, let's say, or a light bulb, the light's more diffuse. The energies are a little bit more scattered, but in a laser, right, they are really targeted. They're really well organized. And so our energy happens that way too. So let's say if I'm one of those people, as you said, they just clock in and out and aren't really invested in their patients, their energy is going to be rather diffuse. And so the ability of their physiology, of their energy levels to have much impact on the clients are probably going to be in the negative way, right? Because it's going to be more a scattering effect of energy. On the other hand, when someone comes in who is really invested in their clients really working, their energy is now more coherent, and it will entrain their patient's energy. So imagine that, like dolphins swimming, they have this really strong energy, and let's say the client's energy is a little bit more chaotic. But because it's close, there's going to be a mutual vibratory effect that starts happening, just like when you put, let's say, a few guitars in a room and you pluck one guitar's D string, the others will start vibrating. So you're going to have that. You're going to have that physical therapist who's putting out that energy. And as this mutual vibratory effect is happening on one another, the patient's energies start entraining towards the direction of the healer. So no wonder you were really noticing how important, what healer do I have in front of me? Who is my physical therapist? It really, really matters. And now we understand some of the energetic mechanisms in energy resonance and entrainment that are happening during that process. So let's back up for a moment, because I have learned that you used and you really appreciated not only the conventional treatments, but also a wide array of holistic treatments. And I would love for you to be able to describe those that are out there for clients to consider, and which ones worked more importantly for you, which ones were working when, because it does seem to be sometimes there's an order of things. If you will, like it makes sense that we might need certain treatments before others, like certain pave the way for others. On the other hand, there's a lot of treatments that we can just do in parallel with one another. And, we can be working them, all at the same time. So thoughts about that treatment toolbox?
Yeah, I think it's important to look at that, because one of the things that's really clear to me is that toolbox needs to constantly be reviewed and changed and improved and cleaned out a little bit and retooled, if you will,
Mm-hmm.
all of the time, depending on where you are in your recovery, because recovery is not a straight line. And
Exactly.
you will always need to change your toolbox. And so I think some of the things that I've used throughout the years is, first, it started out with just standard physical therapy. And at the time that I started, I really, sometimes I was seeing two or three different therapists at the same time, because they might have been trained in different modalities that resonated with me, some that didn't. I even was fortunate enough to have some physical therapists go train in some new modalities to bring them back to me to try to help me. So, of course, physical therapy, if you're in a physically compromised state, you have to do it. And you have to seek out the right people whose energy levels resonate with you. And you will absolutely know that without even speaking to them. You'll be able to
Yeah.
feel it. Some of the other things I've engaged in, I've always been a fan of chiropractic. I think if you have a brain injury, there are a lot of things that chiropractic can do to help you to just sort of feel more centered and leveled and balanced. But I also, at the same time, underwent acupuncture, and acupuncture in a couple of different ways. I trained with somebody who used acupuncture with energy. attached to it. I had an acupuncturist who did a combination of acupuncture and medication, which was really powerful as well. And I probably used three or four different acupuncturists throughout my recovery, depending on what I needed at the time. And by the way, I also want to say, these things don't just appear to you, right? Recovery is an active engagement all of the time. I think as a general rule for me over the last 20 years is probably every couple of weeks, I'll sit down and spend quite a lot of time doing research on some of, the newest tools available to me. And they're out there. Thank goodness for this amazing thing called the internet, because I've been able to find a lot of new innovations over the years. So started with physical therapy, went to chiropractic with a combination of acupuncture that has changed throughout the year. I've also, as I mentioned before, with the neuroplasticity, did a lot of energy healing, which is really important because you can't dismiss the emotional impact this has on anybody who's in recovery. This is a not for sissies, to use a
Exactly.
cliche that I think is overused, right? And emotionally, the ups and downs of recovery take a toll on you, right? So I've worked with energy healing. I've worked with therapists who specialize in trauma therapy, doing EMDR, doing things that really help me to, calm some of the trauma that happened to me early on in the brain injury, where I was afraid I would never get better, and just really the fear of the physical things that happened to you at that time. So I think energy healing and therapy that has energy healing surrounded with it, like what you do, Valerie, I think is really, really important, almost as important as the physical therapy. I've also done work with different types of body work. So, for example, there's a modality called egoscue, which is developed by a chiropractor who helps people to sort of center their body again. A lot of injury in our body, knee injury, hip injury, back injury, comes from not being centered, right? When you're paralyzed on one side, you're kind of the poster child of, not being centered. So doing the kind of work to help center my body and try to, kind of reawaken some of that proprioception to just help me, physically be more level was really important to me. Also, something that's interesting with chiropractic now is chiropractors are starting to use a lot of interesting modalities like shockwave therapy, which I don't know if you've heard of that. It's some of it called medic wave, and it really kind of helps to help with scar tissue breaking down in your body. When you have a lot of injury or you have physical or even a brain injury, you can have a lot of scar tissue in your body that causes chronic pain. So utilizing that has been just as important as the chiropractic and the acupuncture in just helping me with pain management. One
And
of
that one was called Medic Wave, you said?
Magnetic wave is the tool, but the overall modality is called shockwave therapy. And there are
Interesting.
different tools.
Is
Uh,
that using pulsed electromagnetic fields like PEMF devices?
yes. Yes. And I don't have all of the details of the technology behind it, but I can tell you it's very effective from a pain management
Good, good
standpoint.
to know. Yeah, I'll have to look more into
Yeah.
that. Mhm.
There's also laser therapy, which is, it's not a cure. It's just really something that helps with easing pain that, people who have physical injury and chronic physical injury and the pain that results from that, to just kind of help calm the body down, reduce inflammation. That's also important, really understanding how inflammation impacts injury, whether it's brain injury or just physical injury, that's all really important too, right? Understanding how nutrition plays a role in it. And so that I've done kind of in conjunction with the chiropractic and the acupuncture and the energy healing. Massage as well. Massage is really important when you're injured, not just for the injury itself, but really just overall. We really have a tactile. I discovered this personally, and I do not know all of the technology behind it. You would probably know better than me, but physically and tactile senses are really important when you're recovering, right? Really just kind of thinking back to when we were babies and our mother would touch us and rub us and how important that was in our brain chemistry development, right? And how to calm ourselves and how to work through things like injury and pain and chronic issues that we face as we grow older in modern society. So that was important. I think I kind of categorize that in mind work, but I also engaged in a lot of different types of physical therapy. It's important to see what's new coming out. There's a physical therapist I worked with who trained in a modality called TMR, which is total motion release. And this is the thought that our brains work in mirrors, right? And that, if you put your hand on a mirror and you follow it, the brain really does want to be symmetrical. And so total motion release is a really amazing physical therapy that helps people to get over injury and surgeries, where you might have one side that's recovering better than the other. TMR can be really effective, helping your brain to help both of your sides remember how to act in unison. So that is a really fascinating physical therapy tool within the field under the umbrella of physical therapy that people have to look for. And that's not the only one. I think I've learned about a half a dozen specialties within physical therapy that help with different types of issues that people face, right? Not everybody has a brain injury. You might have, just a physical injury that's gone your whole life. You might even have, things like amputations. All of those really kind of do have a huge impact on our ability to think through it. So doing the energy work is so important because I firmly believe that the Western medicine tools that we have cannot be as effective unless we're doing the energy work and really kind of understand it from the neuroplasticity standpoint, how to onboard that technology and really help it within our bodies. Does that make sense?
It does. And at the same time, I really want to hear more about what you're thinking there because I agree with you completely.
Yeah, I think for me, had I not engaged in the visualization, in the energy work that I did, I wouldn't be able to take the medical technology and really apply it internally so that it could help me, right? I do really believe there's a connection there.
Well, and I think the connection is like I said, right now in the science standpoint, we're just now getting more and more advanced, meaningful consciousness models. We have a long way to go, but again, I think once they start realizing that every cell is conscious, every atom, every subatomic particle, no wonder there seems to be these, like, let's say in quantum physics, right? I mean, that's the part of the mystery of the quantum physics. Why is it that subatomic particles seem to be in all states at once in a state of superposition, but somehow when we humans get involved and start observing and measuring, next thing you know, these subatomic particles have gone from probability all states at once to a very definite state. And that's a mystery, right? If you're coming from a materialist paradigm where the physicality, the building blocks are everything, that wouldn't make sense, right? We're used to believing in a regular space and time and everything's made of matter and building blocks. And so consciousness having some role, that it just doesn't make sense. So I think the people who are struggling with the paradigm shift are the ones that are really struggling to understand quantum physics. Whereas for other people, if they've been, let's say, spiritual experiencers their whole life, or some kind of an experiencer their whole life of non-local consciousness, then the quantum is what makes more sense. And the classical doesn't make as much sense because the view is you don't really see matter as a building block. And, even in conventional physics, Neil deGrasse Tyson, wait, is that how we say his name?
Yes.
He was in the Cosmos series. And I remember in one of the episodes, he's standing in a cathedral and he's pointing out the little dust that's floating in the sunbeam. And he says, see that little speck of dust? Every time we think of what is something made of and we go look into that speck of matter, we actually find that it's 99.9999% space. But when we go look at the little speck of that matter, we find that it too is made of 99.999% space. And to illustrate it, he was standing in the cathedral because he said, it's a cathedral full of space compared to the dust speck of matter. No matter how deep down the rabbit hole you go. And that's not even in quantum physics. That's even in classical physics. And we're still amazed in finding out what is the nature of space itself. And they'll find out when they do measurements that in less than a proton volume of space, that's pretty small, right? Less than a proton volume of space, like each little atom we have as this little proton, in less than the proton volume of space, there is more energy than in all the material known universe combined calculated.
Wow. That really does.
Right? Even in our universe, they will, the visible electromagnetic spectrum is just a speck, something like 0.0035%, I think, of the broader electromagnetic spectrum. And then physicists, will say, we really only know what about 4% of the universe is. That whole 96%, maybe 95% is what we don't know. And it's really theory right now, theories of dark matter and dark energy. So bringing it back to the body, bringing it back to energy healing, bringing it back to who do we think we are and how does consciousness, how does all of this play a role? I think what we're going to find over the next decades is it might be that space is a consciousness. It might be that when we're using imagery, like you said, the physical training wasn't as effective unless I engaged it mentally and energetically. So we might find that when you attend, you are lasering in and making the energies more coherent. When you intend, you are providing the fuel behind that. What is the fuel that's going in this direction, right? If I have intentions of healing as opposed to destruction, those are very different fuels for the laser direction that I'm attending to. So doesn't it make sense that in energy healing, we can attend a direction for the healing, we can intend, and we've found that love and gratitude, when they start measuring effects, some of the viewers may have heard of Masaru Emoto's work. He started working on water crystals because he's like, well, we're mostly made of water when it comes to what are we actually made of. So let's see what happens with water and intention. And they found that it definitely made a difference on let's say the crystallization. So he would label water with, let's say, negative thoughts, and it would look like pollution at that, when they would look through the microscope or the equipment, it would kind of look like this blah, it wasn't coherent at all. And then when they would, let's say, on that water, label it with love and gratitude, it was like these amazing crystallizations, like, anybody who looks at the movie Frozen, that of course is so popular, with all this beautiful crystallization and fractals and what have you. That's what love and gratitude did. And the movie What the Bleep Do We Know was like, and imagine what our thoughts do to us if we're made of mostly water. So, I mean, like you said, these aha moments become really robust when we start realizing that what we attend to matters, what our intentions are matter, and no wonder how we focus really plays a huge role in our healing. And by the way, even in regular Western medicine, they did some studies and they showed, sadly enough, that the physician's prognosis had more correlation with our recovery than anything else.
Yes.
That's in regular medicine. So I think, to our point, it goes to show, like, what their thoughts, how are they thinking? How is that projecting an energy on us? How is that starting to take us in a really vulnerable state when we're our most scattered, when we've just been through trauma and we've heard all this bad news? And they take us in a very scattered state. And it's almost as if their prognosis is now moving our subatomic particles in the direction of their prognosis. And no wonder someone like you is a living miracle, because you have, despite all of that, your energy field stayed coherent. You took charge. You took charge of the direction of your thinking, the qualitative nature of your thinking, this determined part. And I think the picture you're painting for our viewers is just how dynamic the body is. In a way, you've been a living experiment. And our viewers can learn through you that no wonder why we need to work hard, but no wonder how we might work too hard, because there's always this dynamic interplay happening where we're working on our recovery. The neuroplasticity is kicking in, right? Like it's dynamically responding to what we're giving it, and it's restructuring, restructuring, restructuring. But we have to give it enough for it to grow and to move, but not so much that it can incorporate it, because we have found in some lines of research that, just even in regular, probably in athletics, you probably know this research more than I do, right? Like even athletes who are working out, they have to push themselves to a certain part where it's rebuilding tissue. But if they push it past that point, they're just destroying the muscle that they've built. So, you've been our guinea pig. You have been the one, like they don't have all these thresholds of recovery out yet, right? That will be the physical therapist of the future. They will be able to say, do this, but don't overdo that. Yes. And the do this will be your maybe times 100, but maybe it's not times 1,000.
Yes.
You know,
exactly.
That's where the future of research has got to be. And like you said, the role of the energies that we're putting in with our thoughts and our intentions. And let's face it, even in regular Western medicine, stress has been correlated with every one of our Western diseases. But they don't understand why, because, right, stress has been poo-pooed as something mental and not really having physical effects. But there's all kinds of psychokinesis, PK kind of experiments that show that mind really does have physical effects. One of those, by the way, was William Bengston. He specifically chose 100% fatal mammary cancer for the target, to put this tumor, this cancer tumor, in rats. And he picked it for obvious reasons. In the whole history of literature, it had been 100% fatal, not 99%, and every once in a while there would be a recovery. No, it was 100% fatal 100% of the time in a long history of research. So he picked that to test energy healing. And at the time, he was an atheist. He did not believe in it. He really wanted to kind of show that it was a bunch of bunk. But he proved the opposite, actually. And before his death, he was out there taking, people who didn't really believe, people who were not gifted energy healings. He was kind of helping demonstrate that we can just take Joe off the street, teach them some energy healing mechanisms, even if they don't know what they're doing, and it has effects. And to that point, where is that recovery threshold? There, I forget the exact days, but you could kind of see these days going by when they thought nothing was happening, nothing was happening, nothing was happening, nothing was happening. And they almost quit. And they kept thinking, well, okay, a few more days. Well, okay, a few more days. And all of a sudden there was that day when something dramatically happened. And then the mice started recovering. And so The Energy Cure is his book, and I definitely recommend it for viewers. But all of this speaks to what you're trying to tell people is, don't take prognosis as 100%. take charge, use intention, use attention, use mind body, know that our how we're reacting and our stress really is causing inflammation, which has a physical cascade and is going to be problematic, just like if I overwork my muscle groups, if I overwork my body, that is going to cause inflammation and it too is going to have a problem. So it's like you said, it's about realizing how big the toolbox is and knowing how to use it. So,
True. And Val, if I could just interrupt a moment too and back up a little, I thought what you were saying about that energy was really important. And if I could apply that to people who are in my condition, right, and how we operate on a day-to-day basis, I really am reminded about our levels of energy, right? And that is, as a modern society, now more than ever, we really are operating in these very catabolic levels of energy, really way down low of energy. That's a really, can be a very damaging place, right? It's a very negative energy place. And where we really want to consciously be as at a more anabolic level. And if you think about it, the condition of being injured chronically or short term, whether it's a brain injury or something else, is a very catabolic place to be. And
yeah.
so it's really important that we do make a conscious decision to raise our energy level in order to bring ourselves up from that level of catabolic energy so that we can then be open to new ways that all this, as you mentioned, that healing can come in and actually do its job. If we're not open to it, if we're not listening for it, and we're not ready to hear the message, then we will find ourselves being at that energy, low energy, that catabolic energy that really has no place in areas of healing, true healing.
And yet we know that, it's easier said than done, which is why I think you should have the last word to tell viewers on, like, what do you advise? Because I can have such compassion with how hard it can be when you've been given all this negative news, when you keep having all these negative prognosis, especially if we are already, like you said, you were young, you were just 42 when all this started happening, and you're noticing the difference now that you're a little bit older, and again, you still have to work it. It's a dynamic interplay that's constantly happening, and you have to adjust a little bit as you've gotten older. So, like, you're the better voice for letting people know when you're in this difficult of a situation, what works? How do you go from probably utter trauma, depression, anxiety, fear, terror? How do you turn it around?
Thank you. It's a good question. And I think to a certain extent it is different for everyone. But
It
for
is.
me, I realized early on that I had to be very selective in onboarding information that people gave me, right? If I listened
Yeah.
to the doctor that told me I might never walk again, this might have been a very short story. And so I think really being very selective in choosing for yourself about what you can or cannot do about your healing is really important. And, really filter that in a way that works for you. Also, never be afraid to ask questions and, really challenge your healing community. And don't be willing to compromise when you don't have a healer with you who isn't a partner. Right. So, taking charge of your recovery isn't just about doing the physical work or the mental work. It's about being very selective about who you choose to help you heal. And if you're dealing with a medical professional who for some reason isn't on your same wavelength, who doesn't believe that you have an opportunity to recover, I would recommend that you don't have a place in your life for somebody like that. And instead, you choose somebody who really is open to helping you at all levels to heal. Don't compromise on that. Don't compromise. Don't take everything you hear about the bad news to be the truth. I would also say, really be willing to take full and committed control of your own journey. And that means being engaged every moment of the day, not just to do the therapy that you're supposed to do and do the energy work and the mental work that you need to do, but also to continually look for healing modalities that might help you. And you might go down some roads that pan out to nothing, but it is really important to know what fails so that you'll know what will actually work for you. And I would also say that the road to recovery can sometimes be a very long one. And so surrounding yourself with people who can help you to get out of the low points when you're really stuck in them is really important for you. And you have to think about that ahead of time. And I also think that having that ability to be open to the fact that things can get better, even though they feel like they're at their worst, is also really important. So I wouldn't discount what's coming at you. Take it in, think about it, and then go out and try to find something that's going to solve it. Be about solutions at the end of the day. And I think that if we really all do take full control of our recovery, that's really the only way that we're going to be ensuring ourselves that we're going to get better. And I think really another thing to be important that to be thinking about is, be kind to yourself, right? This is a tough journey. It's one filled with a lot of downs. The downs might be a lot more than the ups. And I think we all have to be very kind to ourselves and really start speaking to ourselves internally in a way that's going to help us to stay up on our feet and stay positive and continuing to look for ways to make ourselves better.
And what's so important about that last point that you're making is imagine that when we have compassion for ourselves, when we're in a state of self-love, when we're just like, you know what? Of course I'm angry right now. Of course I'm depressed right now. Of course, like right now. It doesn't mean it's going to be forever, but we just tenderly, have that grace for ourselves. That is putting ourselves in a state that's open and that's conducive to healing. Like we can be down, and yet that observer awareness in us is just compassionate while we're down right now. And so that's the opposite of the energy that inflames us. So it's a beautiful way to have healing. So what about any things that you want to tell the medical community, right? The medical community has a lot to learn about the experience of being in this situation as a patient and as someone on a very hard road to recovery. What do you want them to know, and what would you like to advise the field as far as future directions?
Well, that's a tough question for me because I have seen so much in the last 20 years in the medical community. And I think if I may be as so bold to advise the medical community, it would probably be to say to be open to the possibility that there are many different ways that people can heal. And if we are open to it, then I think you can come from a place of a better understanding with how your patient or your client is coming from. And I think that it will also open yourself up to finding new tools that you can provide for your patients that you may not have been open to providing in the past for whatever reason. So I would probably ask the community to be open, the medical community to be open to that possibility and to not give up on patients when, maybe the standard course of treatment isn't helping.
Yeah.
And I think I would also advise the physical therapy community to keep growing and to keep challenging yourself and to really look hard at who you are as a healer, right? And that, really your best work is going to be when you're really thoroughly engaged, not just from a sort of technical standpoint, but from an energy standpoint and invested in really helping your clients to get to that next level of healing. And I think that if we can train our physical therapists to see what they do as a craft and as a life vocation and not a job, I think, we'll probably find a lot more powerful recovery coming from that community as well. And by the way, I think that exists. I think I'm seeing it more and more than I did in the early days. And so I'm very, very encouraged by that. And so I would thank the medical community and encourage them to keep doing that. And by the way, Valerie, I want to say I'm truly, truly grateful to the medical field because the good experiences and the bad experiences have helped me tremendously in my recovery. You know, there's a yin and yang, right? You
Yes.
talked about to this whole process. And you know, I think that the benefit that I've had for the medical community far outweighs any of the negative that's there. But it does mean that I had to keep trying to keep working on it, right? So if anything, I would say keep working, keep growing like the rest of us. And other than that, you know, who am I to you know, criticize the medical community? I think they've had some amazing innovations and breakthroughs that we've been very fortunate to take advantage of in our lives. But as a patient, I can certainly see where there's growth, and I think that's in the area of being open to new ideas.
Well, and to that point, to me, I don't really feel criticism has a place. Like it's never really that helpful. At the same time, as you pointed out so wisely over the course of today's talk, we each have a very unique experience. And that actually, you know, we keep seeing even energetically, like we really truly are very unique, energetic beings. There are, just like there's no two alike snowflakes, there's no two alike beings. You know, we're each very unique that way. So doesn't it make sense that that worked for her, but not for him? And that maybe works for him, but not for her, which is why we have to appreciate the entire medical, integrative, holistic, classical, conventional, like all of it has a place. And we just have to appreciate all of it and have compassion that each of us are doing the best we can. It's very difficult to try to become an expert in everything. So that's okay if we each have our specialty. And to your point, the recommendation to the medical community was, as someone going through the healing, openness goes such a long way. And if they can be open, if they can really appreciate when they have a client in front of them that is really invested in their healing, wants to be just an important part of the healing team as anybody else in the healing team. And if we can all just treat one another with that level of respect and openness and you know, feel free to recommend things. And you know, we can say it's experimental, but you know, feel free to at least let the client know about some of these things and about some of the experimental things that are coming down, because the client might want to try to partake of that. So like you said, criticism we don't need, but it really is important for the medical community to constantly hear from patients what really helped, and all of the different modalities that helped, because that's going to help pave the way in their field, you know, for their future.
I agree. And by the way, I should say, I think
Yeah,
a lot of the incentive from a medical professional comes from what they hear from their patients, right? So as a patient, it's up to us to challenge our medical providers, to ask tough questions, to not be willing to compromise on, you know, the answers we get back. You know, it's okay. It's okay to challenge our medical professions. It's okay to challenge them to do better for us, right? They won't know how to do better unless we challenge them. So don't be afraid to do that. I think we're helping all of us grow by doing that.
I agree. And like you said, we can do it very constructively, and we can do it by asking and requesting. And at the same time, recognizing when we have one of those medical providers in front of us who aren't open, and knowing when we need to change, knowing when there just really is not a resonance between us and our medical
Right,
caregiver, and just know that we might have to change. So, yeah.
right, right.
Any last words of wisdom that you have for our audience? I mean, there's just so many lessons, I think, to be learned.
Yeah, gosh, you know, I would say, you know, go with God, right? And whatever that means to you, right? I have such a huge amount of compassion for people who are on the newer side of this journey. And I would say, don't give up. And I know that might sound like an empty cliche, but the truth is, you're in this for the rest of your life, and you have a choice. Really, on how much of a quality of life you lead or you don't. And so don't give up. Be kind to yourself. And at the same time, be willing to fight for yourself and not compromise on the care that you get, because you're the only one at the end of the day that really owns this vessel that we all live in. And, taking ownership of the care and feeding of that vessel is very important, and you're the only one who can do it. So I encourage you, don't come from a place of being a victim. Come from a place of being a lifelong learner and really learning how to care for yourself and use all the tools that are available because they're out there. And I say that with a huge amount of compassion and love for what you're going through.
Oh, Patty, I love that so much. I so appreciate all of the things we were able to talk about today. Thanks so much for being willing to have this conversation.
Thank you, Valerie. I appreciate that. You don't realize when you're going through the fire how it might, be willing to help people in the future. And I do really hope that some of this might have been encouraging to somebody who might be feeling like giving up.
I am completely convinced it's going to help a lot of people. So thanks again so much for sharing.